In this presentation, we will demonstrate the ethyl acetate sedimentation technique. In the sedimentation procedure, we separate parasites from bulk of the fecal matter by sedimenting these stages at the bottom of a tube. These sedimentation techniques use solutions of lower specific gravity than the parasitic organisms. And as a result, parasites are concentrated in the sediment. In order to obtain the sediment quickly, we can centrifuge the preparation. Or, if you don't have a centrifuge, you can also leave it overnight for the parasites to concentrate at the bottom slowly. Solutions used for this procedure are usually formalin ether or ethyl acetate. Here we will show you how to do the procedure using ethyl acetate rather than using ether, which is flammable and could be dangerous. Sedimentation is useful when cysts and ova are too low to be detected using a direct smear. Sedimentation procedure allows recovery of a large range of organisms, including protozoan cysts, oocysts, spores, eggs, and larvae. Sedimentation techniques can be performed in any laboratory because they are easy to perform and less prone to technical errors. Another advantage is that sedimentation procedures can be done with fecal specimens preserved in formalin or other preservative. So the morphology of the parasite is better preserved. These are the learning outcomes of this exercise. The material required for the procedure are shown here. Take 10 ml of 10% formalin into a test tube or a beaker. Add about 1 gram of fresh feces. Already fixed samples of feces can also be used, as I mentioned before. Mix the feces and formalin thoroughly to make a suspension. Let the mixture stand for about 10 minutes. Strain the solution into a conical 15 ml centrifuge tube. This will remove the large fecal debris. Add some more 10% formalin to bring the volume to 10 ml. Now add 3 ml of ethyl acetate to the suspension. Mix the suspension and close the tube with the cap or a rubber stopper. Now you must mix the suspension well, so shake it vigorously for about 10 seconds. Let it stand for 30 seconds. Hold the tube directed away from your face and carefully remove the cap. Now your preparation is ready for centrifugation, so place the tubes in the centrifuge. Remember to balance the tubes in the centrifuge. Set the centrifuge at 500 G for 3 minutes. After the centrifuge stops, remove the tubes. After centrifugation, you should see 4 layers as shown on the screen. Gently loosen the plug of fatty debris with an applicator stick and pour off the top 3 layers carefully in a single movement. Try to decant all of the supernatant fluid, leaving only the sediment. If necessary, you can remove the excess ethyl acetate using a cotton-tipped applicator stick. Because if there is excess ethyl acetate in the smear of the sediment, there will be bubbles present, obscuring the material that you are trying to see. You can resuspend the sediment in 1 to 2 drops of saline or formalin. Mix the suspension well and take a small amount of this material to a slide. Add a cover slip and examine using the microscope. Systematically scan the cover slip area with the 10 times objective and use 40 times objective if something suspicious is seen for more detailed study. You can make an iodine smear if you want to enhance morphological detail. Some limitations of the technique are shown on the screen.